A wonderful day to you guys. I hope everyone is doing well today. So, I wanted to do a slightly more advanced topic for this session, and it would be divided into two videos for convenience sake. And so, the topic of today is management of acoustic neuroma slash vestibular schwannoma. So, primarily, the factors that determine the approach we use for management are the status of hearing and the facial nerve, then the tumor size and position, the surgical morbidity involved, and the patient preference, which is there in all surgeries. Now, coming to the options that we have. First up, we can use a wait and watch approach. Then there is surgery, and also there is radiotherapy. Now, in wait and watch, we have to monitor with serial MRIs annually. So this is based on the idea that a certain percentage of these tumors tend to not grow or even regress a bit over the initial few years period. Then coming to surgeries, there are three approaches. One is translabyrinthine, the second is the retrosigmoid, and the middle cranial fossa approach. We come to the first approach, which is the translabyrinthine approach. So for all approaches, I would use four headings, which would be the features of the approach, the indications, the contraindications, and the surgical steps. So specific features of this approach are that hearing is lost. However, the facial nerve can be preserved. So the indication, as we know, is a case where the hearing is already poor. And tumors that extend beyond the internal auditory canal, and tumors up to 3 centimeters in size, essentially moderate sized tumors. And the contraindication would be tumors extending to the inferior aspect of the CP angle and involving lower cranial nerves. Now, coming to the surgical steps, we start with a complete mastoidectomy, then perform a complete labyrinthectomy, then we extend laterally and create a 270-degree exposure around the internal auditory canal. Then we need to identify the Bill's bar, which is the vertical crest of bone that separates the facial from the vestibular nerves, the superior vestibular rather. Then we incise the dura. Now comes the tumor removal. And lastly, we obliterate the middle ear and eustachian tube using muscle and fat. The external ear is then closed. So an important factor here is that during tumor removal in this approach, we can use something that is called a CUSA. The CUSA is what is called a cavitational ultrasonic surgical aspirator. So that is all about the first approach to vestibular schwannoma.